Thank you, Raghav Kalyan, for platform opportunity to share my experience in the community pharmacy perspectives, and also
Still can't hear you, sir.
okay, not audible.
Hello? Hello?
Not audible.
Yes, sir. Yes, sir. You're audible.
Okay. Kalyan, for giving us a good opportunity from your institute. So because of in the last decade, I'm working in the neuropathology clearly. Audible, no? Okay. So okay. So good morning, all. So today I'm here with you sharing my experience in the last decade. So regarding working in the field of community pharmacy perspective. So today I have discussed regarding two perspectives. One perspective is discussing regarding the from how the community pharmacists the working from the in the last 3 decades from the dispense the different perspectives in the globally. Okay. So community pharmacy practice refers to provision of pharmaceutical and health care services to a local community. So by registered pharmacists. As you are aware about all those that are regarding one of the very important thing is if any healthcare issues, the first point that with the first point of contact will be community pharmacist. Okay, because of why? If any illness, minor illness like common cold, fever, body pain, or whatever it is. Okay, so they directly the patients and the public they never go to the visit the clinicians or so historically the focus, as I told that dispensing, compounding, inventory management, and the regulatory compliance. So patient interaction was limited to basic advice actually. Okay. The current emphasis was from the, as I told, product oriented rather than patient centered actually. Okay. Earlier, well, but nowadays, because of everything that you're getting in the fixed dose combinations and advanced labeling and pack. For example, if other articles which are globally, they connected many hospitals also community pharmacists in that, for example. Decrease of cardiovascular risk by their important role advanced healthcare services and their counseling and their the management of diseases by their counseling and the medication adherence, the many factors, okay, which going to improve the quality of life, the quality of life of the chronic diseases is very important the perspectives. Okay, so like that, the community housing will play a very very important role in the decrease of these or prevention of the cardiovascular risk in the so many chronic diseases like hypertension, diabetes. Okay, so need for cost effective primary care actually. Okay, especially there is a globally like what happened there is a consultant services by community pharmacist. Okay, consultant services by community pharmacist. Especially we see in the country like UK and some countries they have, but the NEH the USA, what they made that consultant services community pharmacist is what is and it depends upon his pharmacy skills. Okay, need for cost effective primary care. Okay, that is what actually growth of digital health and telepharmacy. Okay, so growth of digital health and telepharmacy. As you know that regarding that nowadays we got so many advanced to get the to improve the patient medication adherence. We have developed so many medication app which is going to remember for the taking the medicines and the different perspectives. And also the new concept is not the concept of telepharmacy, especially like how the pharmacist can will play very important role in the policy reforms enabling expanded roles. Okay, the policy reforms and enabling expanded roles. Yeah, the way this especially dignity policy in the countries shift towards the preventive and the collaborative care actually. Okay, because of the collaborative care is very important because of all the perspectives of like in the clinic or community pharmacy and all the different healthcare professions they can do it in the practices actually. Some of the key drivers of fueling change in regional technologies playing a pharmacy roles in the healthcare delivery system. Okay, you know the emerging global roles of community pharmacists which includes in the water roles medical therapy management and chronic disease management, vaccination, preventive care, and recently maybe you know that in the past 2 years,
Sorry to interrupt you, sir, but your screen is not visible, sir. Sir, we can see your screen, sir.
That's visible. Ah, audible? Okay, thank you.
Yes, sir, audible.
From the component dispensing to the to towards the patient care. So like there are some emerging global trends for the community pharmacist, which includes so medication therapy management. Okay, so one of the very important for the community pharmacist in the practices and chronic disease management. There's a risk. So they're showing that more than 30 to 35% the role of pharmacist is having a very good impact on that reducing of the cardiovascular risk problems. Actually, if you refer for in the many countries globally that they made that early detection of the diseases and counseling, they're following the patients by the pharmacist. The different roles perspectives they are played and they made that improve the quality of life of the patients, especially the chronic disease patients. And vaccination and preventive care, as I told that for example, in the last year, maybe you know that by FIP, they conducted vaccination program. So they want to include in the globally, every pharmacist should be a vaccinator actually. Okay. For example, they in the last the month of 2024 February, in the Bangalore, they tried for that training of trainers in the different parts of the India by three or four parts in India. Why? Because the concept was very simple they want to make they want to include for the vaccinations because of that in the COVID time how the scope of the vaccinators the came for very limited number of populations. Okay, in this concept that's why not only this concept because of we are dealing with the medication pharmacists. That's why they made that vaccinations by company pharmacists because of and also education and vaccinations and vaccinators. Okay, so with the both concepts and preventive case in some diseases. Actually. Okay, health promotion and lifestyle counseling. As we know that regarding they are providing so many health services and regarding the counseling and regarding lifestyle modification and management. Pharmacovigilance and antimicrobial stewardship. Okay, the pharmacovigilance and antimicrobial stewardship. For example, if you see in the Netherlands and Canada, the more number of adverse reactions reporting by community pharmacists, especially in these countries like Canada, followed by Netherlands, and the most of Western countries, the community pharmacists there are more number of reports of adverse reactions to the respective national data monitoring centers. Okay. Especially the concept was implementation of adverse reaction reporting system in Mysore district actually. So because of why I'm telling this in this time, when I approached the company pharmacist, I approached many people, but I got only few number of like they are reporting the adverse reaction to our hospital, especially our hospital is just hospital. One of the 800 center in Mysore district actually. Okay. Here and because of why? So what are my PhD connected to the last the 4 years, which was funded by UGC, uh, like uh, You know, in that project, actually, we are implemented. It was very successful. And the what methodology we adopted in the Mysore city, the same method they adopted in the like different parts of the country, the 10 districts, like in the South India, North India, they started this concept, especially this pharmacovigilance those reactions. Okay. And also regarding this, why I'm telling you this time because of the pharmacovigilance, the concept, because of only the number of consequences because of your like antibodies are like weapons. You are day by day you're losing the good weapons actually. Okay. One more thing I want to tell you regarding this anti-microship. Like recently, the last 3 years, we have started one of the project. Like we are training the community pharmacists and also regarding the and the village side and every 10 to 20 homes. They're the main persons to contact any health related to the public actually. Okay. We are trying them. We are trying the community pharmacists and we are trying the healthcare professionals. We have developed some questionnaires and we have developed some study materials which is validated, implemented, and actually we applied for patent also. And because of it, recently we have published that article also because of we have very good impact, especially by this like the pharmacists and healthcare workers. Because of why we are observed that like dispensing pattern of prescription only. That's why, and we made that more aware
Sir, again we lost you, sir. We are not able to hear. Word.
మొత్తానికి పోయిందా
Challenges in Indian context that regulatory limitations and the lack of regulations of our content services and regarding no
Yes,
investment
sir.
mechanisms, inadequate clinical trainings, and public perception as a business, fragmented policy and limited digital regulation. Okay, why? Because it's very challenges because of with the
Sir,
24 perspectives.
sorry to interrupt you, sir, but the screen is not visible, sir.
Then audible, sir? Sorry, sir.
The screen is now visible, sir.
Okay, thank you. But currently, issues there is a lot of internet issues in this college because of, I don't know. But I connected the very good internet. Okay, so current issues in patient care and exploring opportunities. Okay, so here, actually, what I'm trying to say here, the advancing community pharmacy practices and also in the educations, class educations. Okay, so like how in the urbanly, like in the globally, India, urban and rural populations, how this is going to accessible by the services and like accessibility and challenges, especially is very big for these community pharmacists. Okay. Like the case example is like generation Kendras promote affordable access, and also you know that regarding pilot MTM project shows address improvements medication therapy management. Okay, for example, in India, if you know that anti-TB programs, so included the community pharmacist, what happened? So each pharmacist should identify the patient. Patient means who are suffering from 2 to 3 weeks cough or any symptoms of TB. They're referred by the respiratory doctors to the nearest government lab, and if they are positive means the government will give some one of the monetary benefit also, and also they will recognize, and the particular pharmacist should be take the medications for some treatment of the TB patients. Okay, because how and the centrally identify the role of pharmacist, especially in the medication therapy management projects. Actually, there are different diseases. Okay, the pharmacists to contribute to the vaccination drives. Okay, as I told before, now example we are including the pharmacists especially for vaccinations because it will give step by step. Recently, because of now it will come like family and later going to depends upon the what type of population what are we because they are doing the vaccinations. Okay. And I'm very happy to say, especially that the community housing perspectives, especially like state like Kerala and Maharashtra, they need palliative pharmacy-led screening services, actually, especially the non-communicable diseases. Okay, what are the opportunities for community pharmacists in global scenario? Okay, because of integrated pharmacy in primary health care, and because of that, which is going to play a very important role in the center, integrated to all the healthcare professionals, whether in the nursing, the physician, the pharmacy perspectives, all the perspectives is going to play, especially the government pharmacists, and develop standardize the service methods, develop standard service method also actually. Okay, build capacity through continuous educations. Okay, you won't believe that actually the last 8 years. Okay, we are doing a continuous professional development programs is in the last decade. Okay, for example, from the my side only of the from 2014, we conducted 30 to 34 programs for community pharmacists because of to reach the advanced education actually because of that advanced knowledge of the medications and what the correct under the pharmacy practice everything is going to reach to the that especially every pharmacist we made that involvement the medical profession. Okay, so there is the what is adopt digital and telepharmacy tools, as I told that, advocate for reimbursement and policy inclusions, strengthen public trust in the pharmacy system. The very important thing is emerging opportunities in Indian community pharmacy. Okay, emerging opportunities in Indian community pharmacy, expansion of clinical services, including chronic disease management, and role of sorry rise of telepharmacy and digital health platforms enhancing access. Okay, and strong government support via health schemes and policy reforms, and also enhances collaboration with physicians and multidisciplinary teams, expanded career advancement and specializations opportunities for pharmacists. Well, these are very important emerging opportunities in county pharmacy, especially they can do during the practices, they can adopt that many factors which can recognize by the public actually. Okay, like some of the global models of county pharmacy practices, as I told in the UK, new medicine services, and also the new medicine services, for example, CPC, consultant pharmacy to the uh, consultant pharmacy, community services actually. Consultant pharmacist through community services under the National Health Services in the UK. Okay. The USA, medication therapy management, MTM. Okay. In Australia, HMR is very important concept because of you know that HMR, especially in the remote area or elderly patients or chronic patients, which is very helpful concept for responding this open review and quality control of pharmacy practice and in the Canada, the prospective authority for the elements. Okay, the prospective authority for minor elements in Canada. Europe, integrated care pathways and vaccination projects programs. Okay, because of there are multiple names like that. That's why integrated care pathways and vaccination care pathways. So in here, some of the regulatory framework driving community pharmacy educators evaluation in India was globally. Okay. So what I'm trying to say here, if you see that regarding uh, the minimum education is required to establish a community pharmacist in the different countries, their regulatory bodies will take into okay. Because in India, the diploma pharmacy, the 2 years course is minimum qualifications to establish a community pharmacist. And regarding in the USA, like BPharm practice and UK also regarding for minimum for 5 years course. In Australia also and Canada also, as very so minimum, they have 4.5 years actually, especially to make practices or to get a license actually to give examinations. So, great. And the different exams to clear the license for the working as a the pharmacist. Okay, because of in the see the globally, I was surprised because of the year to work as community pharmacist, then no one going to work, but the more scope, especially is there in the globally for especially for community pharmacists. So global was Indian community pharmacy services like the perspective key contrast like I just have to share that global community pharmacy, which extensive clinical services including immunizations and medical management and well-defined license and clear scope and rigorous regulations and patient-centered role with the strong international collaborations and broad adoption of e-health, like health automation and telepharmacy, high emphasis on patient counseling and chronic management, advanced post-graduate education and post certifications. Okay, so they were the global perspectives. In Indian country to the first primary thing is this: to discuss with the emerging critical goals actually, developing regulatory framework with the limited enforcement actually. Most dispensing focus on limited clinical operations. Growing but uneven integration of technologies, especially in the different perspectives, and limited patient awareness and counseling practices, and basic degree education with limited specializations in the India. Okay, so see both the perspectives in the globally versus kept Indian perspectives regarding that the perspective of community cost. Okay, the role of perspective. The way forward, especially you know that. develop a national pharmacy practice framework. You know that especially by in 2013, 2000, because of the pharmacy practice regulations. Okay, though they refined again, they introduced because of everyone should adopt that good pharmacy practice, especially for that dispensing regarding adding medications and different concepts actually. Okay, so that's why here they mentioned there was develop a pharmacy mentor, so develop a national pharmacy practice framework. Okay, align education with the global standards. Okay, foster interprofessional collaborations. So promote practice-based research. Okay, and encourage digital and public health integration. Okay. So here you see that how the forwardly the perspective of the working as a pharmacist, which is going to play the role of distributor and the role of in the as a uh, public health caretaker. There are many things are there. Okay, they are going to take the their interest concepts actually. The key challenges slowing the 24 transformations. If you see in that, especially the four perspectives, one is regulatory barriers and workforce skill gaps, and infrastructure and technology deficient, and patient awareness and trust concerns. Actually. You know, from the regulatory body barriers, licensing restrictions against the pharmaceutical form border to clinical rules. Uh, as I told, regulatory barriers, which is licensing restrictions concerns the pharmacy firm broader clinical rules and pharmacy scope of practices. Okay, there is a gap between the word skills. Skills because of skills very important for that, especially for the community pharmacists. Okay, and lack of sufficient clinical training components and minimum practice exposures and also role of pharmacy in the patient-centered pharmacy care. Okay, and so as a infrastructure and interpreters, there is no issues. We have very and like a widespread of poor adoption of digital tools in community pharmacies and options of automated dispensing system and electronic medical records again. And the patient awareness and trust conference. Public health. The public has limited understanding of pharmaceutical capabilities. Patient prefer consulting patient preferring physician over pharmacist for health advice. Earlier, I discussed regarding how the perspective of the role of community pharmacist in the the concept was changed and the role in the health perspectives in the like as a clinical pharmacist as a community pharmacist in the the services by the pharmaceutical care services. Here, transforming pharmacy education to support practice transitions especially to update the curriculum updates and practical training enhancements and skill development and continuous professional development programs to for the house and the community integrations actually. Okay. In the curriculum updates, like integrate the clinical pharmacy and patient care modules to align education and the modern practice demands, expand internships and real world exposure to build hands-on experience. Skill development emphasize science communication, details, literacy, and technical decision making skills, and continuous professional development actually. To promote lifelong learning through programs and certificate opportunities. Okay. So what will happen, for example, if you know that we are on the academics, whatever actually, to get the update, whatever is update, we're using the social media, so getting the many official websites and official medias. Okay. But in the community power system, okay, the required this continuous professional development programs actually. Okay, continuous professional development programs is very important concept because of you we because we and every year so minimum we'll do to 4 to 6 trainings especially for the pharmacists especially to bring the outcome the role of community pharmacy in India. We are dedicatedly the institution supports the free of cost and body certificate also and with the study materials with the consultant we have to make the very important role of this community pharmacist. community integrations local healthcare needs and community pharmacy practices, especially the needs of the particular diseases actually. Okay. And as I told before, education, so the recently, maybe you can see in the slides regarding the, we have introduced, I think you know that we have integrated residency program in the last 8 years, sorry, 6 years back. The first residency program was we started in India with the oncology actually. Okay, oncology and next is like nephrology and infectious diseases. Okay, but this year we got the opportunity to start the residency program in community pharmacy actually. Okay, community pharmacy. This is program which is coming under me and uh, cardiology which covered the Dr. Siddharth Endupara and clinical pharmacy residency program in geriatric pharmacy especially Dr. Ashraf Hassan. Okay, with these staffs. We do it because of we want to focus only one particular group because the rating actually. Okay. But then, but I told you regarding that the technology integrations framework in accounting first practice. Okay. So digital prescriptions. Okay. Here, so secure paperless decision and dispensing the uh, accuracy and speed. Okay. And automated dispensing. Okay. Here, what they do, you know that robotics actually, because of what happened, I heard that in some countries, okay, in some Western countries, they adopted for handling of some of the medications, dispensing from the hospital pharmacy, from the patient, from the store to the patient bedside actually. They use the robots for the to specific automated dispensing actually. Okay. Mobile health apps and engage the patients with the tools of medication which reminder indications to because of it develop by the particular patient actually. Okay. Electronic health records, centralized medication, centralized patient medication histories for informed clinical decisions and community of care. Okay. Telepharmacy, which facilitates remote consultations and medication management, expanding access to pharmacy services actually. Okay. Telepharmacy. So here, what I'm trying to tell in this, especially present scenario, that these are a global concept, and presently there's a trend, like what you call it, this thing, a digital prescription and electronic prescriptions, uh, sorry, automated dispensing and mobile health apps. We, as you told, different apps are there to see the calculation dose or whatever it actually, and electronic health records actually. Okay, EHR and telepharmacy. And there is a essential skills and mindsets for future community farms. Okay, because of this, very important actually. When the person got a skill means you should have proper knowledge. Okay, the strong legal knowledge with the evidence-based decision making is very, very important. Okay, everything you can take your decisions and effective communication and patient counseling is ability and digital literacy to leverage emerging healthcare technologies. Commitment to patient-centered care and empathy adaptability to evaluating healthcare environments and collaboration and teamwork within the multidisciplinary team. Action plan, okay, because of it is very big. Preparing pharmacy students for community pharmacy practice transitions. Okay, so maybe I know that I don't know how many are there like so engage actively in internships and technical relations in community houses to gain practical experience. So before I told no, we are started 22 months, 2 years almost. The residency program of community pharmacists. You can see, you can go to the what are the studied and curricular activities going to do in the particularly. to research programs. As I told, like here also the same thing. For example, like actively interested in legal relations in community houses to gain fresh experience and develop proficiency in digital health tools and pharmacy software systems. Okay, and stay updated on evolving pharmacy regulations and healthcare policies. Cultivate soft skills. Cultivate soft skills like effective communication and cultural components. Okay, because of here, the very, very important is the way he speaks because of the communications. What we call communications, verbal communication, oral communications. Okay, everything should be very important actually. The way to show the patient perspectives. Participate in community outreach programs and patient care initiatives. Especially community was going to play a very important role in outpatients, the department outpatients actually because of anyone built out and seek mentorship from experienced pharmacists and healthcare professionals actually. Okay. And plus, in the future, dynamic role of community pharmacists in healthcare actually because of we are working because of in India with the 1.4 billion populations actually. You just imagine how many clinical pharmacists and how many pharmacists working in the hospitals and these things. Okay, but more than 90% is very important to make the upcoming the role of community pharmacist and to bring the service to the public actually. Okay, so here the community pharmacy practice is evolving into dynamic and implemented questions because of impactful healthcare professionals. Future pharmacists will be involved in public health through expanded clinical services. Okay. And integration of advanced technology is required is the key for obtaining optimal health outcomes. Okay. Global a collaborative care model has to be adopted to strengthen community pharmacy practices and very much lifelong learning. Lifelong learning and adaptability is essential to thrive and this is the evolving world. Okay. And proactive engagement will shape future of community pharmacy practice and patient well-being. Collaborative care model has been adopted to strengthen the community pharmacy practice and lifelong learning and adaptability is essential to thrive this in his evolving world. And proactive engagement will shape future of community pharmacy practice and patient well-being. Okay. So Uh, thank you. Sorry for the interruptions because there's the between internet was going and coming because of if anything is there, you please drop the message in the if anything related to the community pharmacy perspectives, you please drop the message in the messenger box so I can answer the questions and in the last 10 years because of my personal experience because my research and I most focused on almost community pharmacy healthcare research only. Even the last recently, I got a project from the Pfizer Medical USA, especially for antibiotic stewardship program to the community pharmacies and community therapists.
ఎందుకు
Okay,
ఉమ్.
and
ఇప్పుడు ఇన్సమ్ పట్టిందని
so
వాష్రూమ్
with that,
ఇన్స్టాలేషన్
we made like
బండి తాళం
because of
మర్చిపోయా
we last 3 years we conducted the studies and we submitted we got a very good response. And one thing I want to share here because of still we have many like-minded people to work for the community by this community pharmacist and regarding ASHA workers. Okay, so and we have a better future for the community pharmacist in the role in the especially in the Indian sector also because of day by day as I give example like in the how the changes happening in Kerala and Maharashtra the role of community pharmacist in perspectives. Okay, so And thankful to the all the listeners and the principal and administrators of staff for the college to give the opportunity to conduct this webinar actually.
Thank you, sir, for that presentation. As you said, we had a little here and there because of your internet issue. We were not able to continuously listen to you. And as you said, if somebody is having any information or anything to ask you, they will drop in the chat box. In the meanwhile, I would like to ask you a small question. While at some point of
Yeah,
your
please.
presentation, you were talking about vaccinations at community pharmacy, right?
Yes, yes, yes. Uh-huh.
That aspect, we had a small internet issue there. So I would once again ask you if you can tell me what exactly is the status of vaccinations at community pharmacies and what is the future in that particular aspect.
See, one thing I want to tell you, a very important thing is actually, I told that to become a pharmacist in the Indian, like Indian scenario and global scenario, based on the regulatory body of the country, they require the education and the examinations actually. Okay. So that's why here, because of FIP, what they want to make vaccination for everyone actually, as a pharmacist. But we in India, we first take initiatives for the, especially for the pharmacy graduates. Okay. I don't know because of what happened in the 2024 February. For the FIB, the two people came to train the pharmacist, especially like one staff and one student actually, because of we are training for trainers actually, because of we are going to get the training, we have to train the 30 people actually, other 30 people train the other. It's like a chain system actually. Okay. In the concept was very simple, and even we from the IPA also we have given the from the to the Ministry of Health and Family Welfare for include the pharmacies for vaccinations. So you maybe don't know that in the last 2 3 years still it's going on that discussion in the amendment, especially to include the pharmacies for vaccinations. And regarding in some of the countries, especially for elderly like adult vaccinations like HPV vaccines and like that, they are eligible to give the vaccinations. Okay. Suppose you want to in this concept because of in 2000 maybe in 2023 we have current pharmacist day. Okay, we called our health minister actually, his name is Gundu Rao. We given the amendment letter for the Karnataka government also actually because of still have the copy. And because of why we are trying to make a role of that pharmacist in the vaccinations we are giving to the that Indian perspectives there is a very big challenge by the there is a including the pharmaceutical vaccinations. But uh, there the 2021 countries they include for the pharmaceutical vaccinations. Okay, and that's why I told because I'm happy to share that I am one of the person under the training for vaccinations to our trainers. Even I did one session in the college also for the one batch of pharma students. Okay, and this is the concept because of in the COVID time. The COVID time, what happened? Uh, the as a materials because of why the government was recognized for in the emergency situations in the pandemic time. They include the pharmacies for vaccinations. Okay, but they kept for the vaccination, but it was not useful for the not give the opportunity for vaccinations, but uh, and ultimately they kept for the ready for to give the vaccination for the community actually, by the Indian pharmacy hospitals. But Raghav,
Yes, sir. Yes, sir.
I
Apart
hope
from
I hope you got clear from that by how this is happening and from the regulatory
yes, sir.
perspectives, from the our side also from the IPA, and because you know that from IPA, you won't believe in 2022 only they got the letter for the Ministry of Family Welfare actually, especially for this include the especially see as I told no, we can't include the diploma pharmacists suddenly because of vaccinations. Okay, because why you want to tell all those things? For example, during my training, bro, just I will tell the short time, short, very, very short period. Because of that vaccinations, if you give the patient is very allergic, sometimes you get anaphylactic shock. Okay, anaphylactic shock is a life-threatening serious adverse reactions. Okay, immediately, what pharmacy can do the treatment actually in their perspectives. Okay, So that level training they given by to the pharmacist, especially by the FAP. The two people that come from that, I forgot the name, one from University of Sydney and one from the Monash University, two of the professors. They are both are from pharmacy professions. They trained them actually. Okay, we are they trained them with the on session with the on hands-on training actually, not only demo, because it's a 2 days program actually.
Yes, sir. I'm aware of that program. I think it happened somewhere in Bangalore, where the foreign professionals came and trained pharmacists and also the staff regarding the vaccination program. Yes, sir.
That's right. See, only first we want to include the family prospect, family graduates for the vaccinations. Okay, because of we are expecting medication. Because why? As I told now, for example, pharmacists give the vaccinations, the person got some serious adverse reactions. What's the treatment that to be given? Only it is possible from the family graduates perspectives.
Exactly,
Am
sir.
I
So
right?
there are some
Uh,
anaphylactic reactions to vaccines where we require certain interventions. So that definitely requires some expertise to handle such patients. So that's a good point.
they don't actually, what is the treatment actually? Which steroid actually, where to give, how to give, and regarding what injection to be given actually. Because of we injected actually, because everything we had to do it because on session, on training actually.
Yes, sir. And the last question that I want to ask you is, we all know that the percentage of we all know that the percentage of population who did PharmD or who did MPharm pharmacy practice and they coming into the community setting and practicing as community pharmacists is little bit low. So what do you think can be done to increase that percentage, sir? So how can we encourage a professional pharmacist to enter into the community setting? So what do you think can be done somewhere in the future?
So whatever actually, see, whatever you do doing degree, one thing is actually was profession. The profession and job is an immediate, very important is money actually. Okay, money is very important actually. When you do the pharmacy profession as a the practices perspectives, the thing is very important is the money. Okay. So what I'm trying is to say here, give the professional services to take the money. Okay. Ultimately, you give the professional services, which is going to build the business also. I will get more profit also, you get more money also. Okay. I'll give best example. Okay. I told there is a diabetics patients in more in India. Okay. Suppose the patient come to the pharmacy, first you will ask the what is the last discount actually. Okay. Why you last discount? Suppose there is no proper service by the pharmacist. So what services you can give the patient especially? You should maintain the diabetic diaries. What's diabetic diary? You can start the diabetic histories because you should maintain the diabetic patient of each patient. You should be counsel the patients. You should monitor the patients. You can provide the free checkup of the glucose monitoring actually whether before fasting after fasting whatever it actually you should counsel whether he's taking three things very important diabetic medication, lifestyle modification, and regarding food actually and exercise also. Okay, physical activities. In the three perspectives, if you are monitoring, you are still not reducing means maybe in the perspective of medication not sufficient. If you refer back to the physician, take the whatever medication required according to that you can for management of diabetes. Okay, so like that, you can maintain the diabetic diary, hypertension diaries, each patient. Okay. So you provide the free services. Instead of discount, you provide the free checkup, free health services like diabetic glucose monitoring actually. Okay. You then see how ultimately we can build the patients. For example, every week, every month, okay, we're going to build the patients like anything actually. Like that, each diseases we have to focus on particular diseases which the key role of pharmacist and then give services, build the business, more profit.
That seems to be a good idea.
This is my uh,
Yes, sir. That seems to be a good idea to promote or to increase the percentage of populations. Okay, sir. Thank you. So these are the questions that we have for you. And once again, on behalf of our institute, we thank you for taking your time out and spending your time on this platform here with all of us today. And I also thank all the delegates for being a part of today's session. And we are concluding this session, and we all will join you once again back tomorrow at 11 a.m. Thank you once again, and we are now ending the session.
thank you, sir. Thank you for everyone.